pain procedures won't work? The British Medical Journal, otherwise known as the BMJ, recently published a network meta-analysis as seen above me. This paper reached the conclusion that most of the commonly performed pain procedures for back or radicular pain like sciatica do not work better than sham treatment. A sham treatment means essentially a placebo treatment. As a result of this, the BMJ has published recommendations that such procedures should not be used for chronic spine pain. However, for obvious reasons, this paper and subsequent recommendations have raised a lot of eyebrows in the pain community. Now, this was a network meta-analysis. It's different than a regular meta-analysis in that it compares multiple treatments against one another. Some of the issues found with this study include: this article leaves out relevant and well-done positive studies concerning these procedures, it incorporates irrelevant or non-prevalent procedures and lumps them in with other interventions. There was significant heterogeneity in the articles used for this analysis, which is like, rather than comparing apples to apples when it comes to either interventions or sham treatments, it's like comparing coconuts to mangoes. Both tropical and delicious, but very different. Look, I get it and I agree. Treating chronic pain is complex and requires multiple treatment arms to be effective, not just one thing like a magic bullet. You can even liken treatment to the wheels on a car, and each needs to be inflated for the car to run smoothly. Thus, one wheel could be physical and occupational therapy, another medications, another interventions, and then another chiropractic care, acupuncture, and psychological therapy like ACT or CBT. Therefore, in addition to its methodological limitations, the bigger issue this article fails to address is that in removing a whole wheel from this car or having less air in it will make for a more difficult ride in the pain-free journey. We all call for a multimodal approach to pain, and you should never feel or treat a patient like a pincushion or a medication receptacle, but by making access to one of these modalities harder, I feel the consequence will be patient hardship. I hope in the future, such research efforts could be directed at further understanding who are the best candidates for these procedures rather than throwing them out altogether.